Hi everyone, thank you for joining in today's AgForce over lunch webinar. If you run into any technical difficulties, you can give us a call, our teleconferencing team a call on 1800 733 416. If you think you might have a connection issue, you can reload the webinar, which can be done by clicking on the red cross in the top right-hand corner of your screen. A recording of this presentation will be made available in the coming days and will be sent through to the email address that you've registered with. During the presentation today, please use the chat box in the bottom left-hand corner to type any questions for Cath, who, time permitting, will answer during or at the end of the presentation. I'll hand you over now to Cath and we'll get started on the presentation.
Hello, this is Cath. I'm just finding the first slide. Yep. So, first thing I'll say is thank you for joining. It's very good of you to give up your lunch times, and hopefully I can make this interesting and everyone will manage to stay awake for the presentation. Please forgive me if there's some slip-ups with some of the technology, because that will undoubtedly be my fault, being a first-time user of Webinar. So Hannah's here to assist, and I'll do my best. So I'm currently working with the Royal Flying Doctor Service, and I've previously worked in a number of roles as a psychologist and as a registered nurse, mostly in rural, remote Australia. This topic is a very interesting one to me because it's one of the major reasons I see people when I'm working as a mental health clinician, and it's one of the most requested talks I get. We'll run through the slides and then I won't get too far off the track. If I start just chatting now, I'll be here until dinner time and everyone will be asleep. So I'll get on to the next slide. That's me. For people who don't know me, sometimes I like to actually look at the presenter, so it's a bit unnerving to be in this position when there's no presenter to look at. So that's me, the one on the right. And in my role, I'm often working across various areas of remote rural Australia, and often we use the RFDS planes. Most of you will know of this service, and most people think of RFDS as a plane that comes down and picks you up when you're in deep trouble, when you need to be retrieved from a car accident or you've had a heart attack. The areas I work in mental health, I try and help people to not get to the serious end of illness or accident, and one of the really critical things to help people stay well is actually sleeping well. And we'll get into a bit more of that information as we go on. So it's sounding a bit stilted at second, but once I get into the material, it might be able to warm up a bit. I'm assuming you can all look at the slides because I can see the screen that you're looking at. I think the most critical thing in this slide is really that sleep is such an essential part of our physical health and our mental health. We sleep for about a third of our whole lives, and it appears that we need this. There's a lot that's not known about sleep. It's a very complex process, and it's a very active process when you tend to think, I just go to bed and go to sleep, as if you just switch off. It's actually a time when there's a lot of things happening in our brains and our bodies. There's a lot of recovery time that can only occur during sleep. So poor quality sleep appears to have quite an effect on our immune response and may explain a lot of the illnesses people have when they don't sleep well. So the obvious is that you feel tired, that you've got poor concentration, you might be irritable or grumpy. But we do know that there's a large correlation between sleep and depression and anxiety. What we don't know is what comes first. It may be that you have anxiety or depression and then sleep poorly, so it's a symptom of it, or it could be that you don't sleep well and depression comes as a result of that, which makes sense if you think you're tired and grumpy all day. Your relationships might suffer, and then consequently you feel bad about that. So you can see how they're interactive and quite complex. I've got a figure here of 10% of Australians have a diagnosed sleep disorder, and it probably is underestimated. And the figure I've got there is 13 to 30%. So you can show how little, you can see how little we actually know And with the sleep disorders, we include things like sleep apnea, which I'll get onto a little bit later. But a lot of people don't know they've got a sleep problem. And I spend a lot of my time in education across rural, remote Australia or Queensland at present, helping people to understand when they actually have got a condition, a medical condition or a mental health condition that's treatable, and they may not know they have. So let's hope that just a bit more information over this presentation and the sleep side of it will make sense. I keep wanting to say any questions, so I'm going to have to say any questions, and I know you can't answer me, but if you do have a question, you can type that in. I hope that's clear. Okay, so broadly speaking, my major aim today was hoping that, that it was interesting and it didn't send everyone to sleep, but what I'm trying to cover is what normal sleep is, because when you've got an understanding of what normal sleep is and how long that should go for, etc., you might see that you're actually doing okay and you don't need as much sleep as we think we need. But what I'll look at is the sort of quality of the sleep, the length of time, and common sleep problems that many of us see, and how we can actually help people with that. So some of the strategies that can help improve it. So normal sleep, if there actually is such a thing, but you have to think for a start, and I'll show you a graph in a second, but it goes in cycles. So over an evening, let's just say you go to bed at 10 and get up at 6 or 7, you'll have 4 or 5 90-minute cycles of sleep. So we go through light sleep, and you'll see the figures, light to moderate, moderate, deep, and rapid eye movement or dreaming sleep. What we are pretty confident about saying is that the first 3 to 5 hours are the most restorative, when most of our healing goes on and the body balances itself with the various neurochemistry that's occurring during this period of time. I hope this graph looks okay, but just the basic principles of it is what's important. We're starting up at the black in that first period of sleep, so you've just gone to bed and you're still awake. And then you're dropping down into the sort of yellow stages when it's light sleep. And then the second stage of green sleep, still pretty light. And then you'll see it's going up again, a bit to light sleep and down again. And this is all within the first 90 minutes. And then you're dropping into deep sleep. So there's quite a lot of sleep that's going on that actually isn't deep. While you're in sleep, quite a lot of sleep that's going on that actually isn't deep. While you're in sleep, light sleep, it's quite easy to be roused. And when that happens, might be a dog bark or there's a bit of a noise or a curtain rattle, something like that, you can wake up, but you're actually just waking from light sleep and going back into light sleep. So often your perception as you're coming up again to lighter sleep is that you haven't been to sleep. So you may actually be asleep, and we don't know this until people go into the sleep labs and get hooked up and wired up, various tests taken. We don't actually know how well we sleep unless you've got all that information. And you'll have a perception of it. And what we'll get onto later that's really critical is everything about this topic is how you feel in the day. What happens at night actually isn't always as critical. So just bear with me for a minute as we go through a bit more information. But basic point here, we're going light sleep into darker sleep, coming into lighter sleep again, going through rapid eye movement at the end of that first cycle, and that's when you'll get dreaming start, and then waking. So it's very, very normal to wake for a minute or two every 90-minute cycle. And again, going back into light sleep again, when you're very easy aroused, you could be thinking for 30 minutes, I'm not asleep, but actually you are. So light, deeper, and that deeper sleep you'll see in those first 3 cycles, and that's what we're calling the most restorative. That whole period of sleep. We don't know that just deep sleep, so that whole lot. So that's a normal adult. So I hope a lot of you are feeling like a normal adult at present. Then we look at another normal adult, but a young one. And a good sleep for a younger one, you'll see straight away that they're going into deeper sleep more quickly, and they've got more stage 3 sleep. So it's gone deeper, earlier. And that's the major point from that sort of sleep. You've got a lot more green sleep, if you like, as well. So they're probably needing and requiring, and that's what we're saying now with adolescents. It's up to about age 25 now. that often they have got a greater requirement for sleep and need this deeper sleep, but they don't get as much for all the various reasons that people up to age 25 don't get as much sleep as they often need. A lot of it being going to bed later and using a lot of the time screen time. Okay, so how we sleep, just in an overview of that, is the circadian rhythm is critical, or the biological clock, and that needs light and dark to operate. And it also explains a lot of what's called siesta time in some countries. It explains why some people are night larks, so they wake early, and the owls which like to go to bed later. The length of sleep and life stages, we've had a little bit of a look at that, and the changes as we age we'll see in a second. So keeping in mind the critical part of light and dark, the brain really responds, the circadian rhythm is all really governed. It's a biological clock, is what a lot of people like to talk about it. It's really situated in an area quite deep in the brain, but basically behind the eyes. You would have heard of things like melatonin probably. There's a very complex process goes on between the biological clock or the circadian rhythms, melatonin production which occurs at night, and other neurotransmitters, largely one called adenosine, and that starts to be produced as you're awake and very active. It's a byproduct of cell metabolism. That's about as complex as I want to get, otherwise I'm going to start tripping all over my words, and it does get more and more complicated. But just think this dark and light, and that will explain how to assist people when they sometimes can't go to sleep until late or when they wake up early. It's very difficult for many of us that work shift work, but we can do things to try and create situations that make the brain think that it's time to go to sleep and not take drugs such as caffeine, which interfere with some of those processes that I was talking about, neurotransmitters that build up during the day, caffeine block. So that sort of explains why tea and coffee at the end of the day is not so good. There's so much information about this online, and I'll give everyone the links to that I won't try and go into any more detail about the neurochemistry of this sort of really complex physiological process. I hope that's okay. I can't see anyone nodding, so I'll look at the other three people in the room and think, do you think that's enough on that bit? Good, I'm getting nods. Okay, how much sleep do we need? 5 to 10 hours. How's that for a big average? So keep in mind, a big range. Keep in mind what suits you. How do you feel during the day? 7 to 8 hours seems to be about average for an adult. It's not the length, it's the quality. We've talked about that, and the first hours seem to be quite critical. As we get older, we tend to need less sleep. I don't think it's because we need less body repair, but it's for some reason that the brain knows best about. But people, as they age, particularly when we see this in aged care, often spend more time in bed. So this can be a very frustrating time for people. They may have been dairy farmers, or they may have needed to get up really early, but they're getting to bed earlier and earlier as well. So they might be spending 12 and 15 hours in bed and feeling really frustrated with just the whole process and the boredom of it, and they can't get to sleep. But the brain, the body simply don't need it. So the judgment about what's needed is critical, and we talk about this a lot in treatment with people with sleep, that it's their perception that's so critical, and I listen very much to what they're saying about how they feel when I'm trying to help them with strategies. And this isn't supposed to, I read this comment just a minute before we went on. Research, in a lot of our research, most insomniacs receive this core sleep, so that first, say 5 hours, despite the fact that they'll say, I haven't slept all night and I feel terrible. And that's not supposed to be a criticism. So people who see themselves as an insomniac, we're not trying to say, you're wrong, you don't know what's going on, but we're trying to explain the whole process that's occurring and just help to really sort out where the problems are. So in reading that, I hope that's not offensive to anyone. Common sleep problems. So we're not going into the really rare ones, but I'm happy to take questions from people online now or by email if you think that I'm not covering your sorts of areas of concern. But the common ones are people having difficulty falling asleep. So you get to bed at night, you might even be tired, you might have even been gardening all day or out in the paddocks or working physically hard, but you still don't drop off to sleep. Yet that might be to do with worry or thinking a lot, and we'll get onto that as a specific difficulty. Waking during the night, and again, wake and worry is a big thing there. Nightmares can be a real difficulty for some people. Even sleep, or ordinary good dreams, for want of a better word, can be difficult for people because they have such a good dream, they get really caught up in the dream and then they can't go back to sleep. So they might have a better time at night than during the day at times, and it's not as silly as it sounds. Circadian rhythm problems start to get a bit more complex, and then we need to look at things like what's going on for people medically and what might be happening in terms of their lifestyle. Like you can have delayed or advanced, we'll go into that separately. And just poor quality sleep, that can often be tricky. It could often be that even hooked up in the labs, they still not are getting quality sleep, even though apparently they do seem to be getting light stage 2 and 3 sleep. Remember this when you're talking to a doctor or a sleep specialist, psychologist, someone about your sleep problems, to really try and come in with information about what's happening for you. So, top on the list of causes of common sleep problems, children. Possibly something you can't do something about. I was talking to someone from a property a couple of days ago with 2 children and currently expecting another one, 2 children under 4. It is something that pretty well all we can say is you will get over it. It sounds really harsh, but it's true. A lot of the other things are prolonged stress, trauma, shift work, medical conditions, menopause. A lot of things that you really just have to work your way through. Treatment. The first treatment is see a GP. Sorry, I just need some water. The room's very warm, isn't it? It's very cosy. Okay, so any sort of health check with the GP is always worthwhile here because you often need to know just what's happening. And I obviously can't diagnose that. I'm not a medical doctor. And it's something that's always worth checking first. Discuss medication with your GP and consider withdrawal from various sleeping tablets that are often prescribed. And I don't mean this for 1 second that you should do this on your own bat. It's something that you seriously consider with your doctor. But as we'll talk about in a little while, there isn't good evidence that long-term use of sleeping tablets actually work, and you can become dependent on them. So it's a serious consideration, and you shouldn't ever just stop taking them straight off. There's a lot of other sorts of medications that are suggested now, and again, get good information from your doctor about that. But it falls into this category you'll see, still NOx and Unison. So they're the sorts of medications that aren't the ones above, the benzodiazepines, the tranquilizers like temazepam, Valium, that some people do have some difficulty with these other drugs. Antidepressants are sometimes used because they can have a sedative effect, and melatonin has been artificially produced other than the way we produce it ourselves, and in certain conditions, some of the circadian rhythm conditions, it can be useful. So as a non-prescriber, I can't give you specific advice, but I can always say to people, just make sure you really check out the medications. Is your sleep problem to do with some of those medications, even medications for other sorts of conditions, and check that out carefully. And at the end, I can give you, at the last slide, you'll see a place called Reconnections, and it specialises in helping people with sleep difficulties and helping them with some of these medications. Okay, insomnia. About 1 in 3 people, that's quite a lot, mild insomnia, or sometimes it might not be chronic. Some poor sleepers have developed poor sleep habits. We've found that specialists help in the psychological department. A technique, or sorry, a model called cognitive behavioural therapy for insomnia seems to be best. It's just what the evidence is telling us at present. So if you go to a psychologist or counsellor, clinical social worker, often they'll say CBT is really good to help with sleep, and that helps with some of the thinking that we have trouble with and some of the behavioural difficulties and problems or habits that we've got into that actually interfere with sleep. In the long run, as I've said, it doesn't appear that sleeping pills are effective. So much better go to the GP, check it out, and then maybe do some online research. I can give you some resources for that, and maybe look at who might be a specialist in your area. And RFDS has a number of clinicians, and you can contact the numbers at the end in your area. For example, we've got one in Longreach, we've got one based out of Townsville who goes across to Mount Isa, we've got someone based in Mount Isa, and we've got someone down around the Cunnamulla, St George area, so they're all clinicians that can assist with this, and there's many other clinicians and doctors that can help in this area. We're also growing our team, so we might be able to help more into the future. Thank you, AgForce, for putting this webinar on, and we can get some of this information out there. Slight diversion. I get a breath. Need a laugh. I hope it's going okay for you guys out there. Guys, I mean collectively, it's not just men. We can see your names. There's men and women attending. Again, I remind you, put in some questions if you need to. Okay, treatment for normal sleep problems. Understanding the normal sleep routine, or normal sleep, how it works, and good routine. We've covered a bit of that. Exercise seems to be critical, but many people I work with in remote areas tell me that's what they do all day, but they still have sleep problems. It does seem to be in exercise that there is some value in the type of thing like a daily walk, a fast, brisk walk, rather than necessarily the brief, intense things like pick and shovel sorts of work, or the sorts of work that people work in remote rural areas. They might be on and off horses, they might be on and off tractors, they might be opening gates. But some of the clients I've had over the years do say, when they've taken up this option of doing a daily exercise, have actually said it's been great. Now, whether it's something else, one couple come to mind on quite a remote property, they actually went for a nightly walk in the evening after dinner, and they actually said no property talk, no financial talk, nothing. We're going to talk about our holidays. And the wife chipped in and said, what holiday was that? Our honeymoon 45 years ago. But it could be that you come up with something around that exercise that's the critical thing, not just the physical lifting and shoveling and riding and things you do. Relaxation I'll go on about a little bit, because it's not watching the telly or watching a video game or doing a video game, something like that. That may have a type of relaxation effect, but what we're talking about here is a trained physiological response, things like getting a CD, and I can give you some ways to get hold of that, or doing something like meditation. There's various relaxation strategies that, for example, you teach all the muscles of the body to respond on command. So that's when you'll hear people say, relax the muscles on your right hand, relax the muscles on your right arm, and you go through the body bits. It seems to have a feedback to the brain to turn off a lot of the stress responses, and that's different from reading a good book. It's a trained exercise, so it requires you practice it during the day. A lot of people come undone with this because they put on a CD in the evening, or when we used to use CDs, that's what used to happen, and think, I'll put that on, I'll listen to this nice voice and I'll go to sleep. It really doesn't work very well. So it needs really to be a trained response, and can often take a couple of weeks, and it's a really important one. Again, you can read a lot more about that. And it doesn't have to be tied to sort of a spiritual type response, and that can be really useful for some people, but it can just be a physical response that the brain starts to recognise you've got into this relaxation mode. And it appears that when we hook people's brains up, when they've done this, we see a rhythm called alpha rhythm, and that's consistent with feeling peaceful and calm. And there is a lot of research that tells us now that that could be conducive to assisting the immune system as well. The jury's out on this because it's never-ending research. It's just something we keep working on. Behavioural and psychological strategies I'll go into a little bit more in the next few slides. Okay. Caffeine, food, alcohol, and smoking, all problematic for sleep, depending on how you're using them. Caffeine, it seems to think, as I said, it can block one of the neurotransmitters that actually induces feelings of sleepiness that the hypothalamus controls, the brain controls. Try and avoid it for at least 4 hours before going to sleep is one chunk of advice we often see earlier. Some people, it's not good for them for most of the day. It does have a cumulative effect over time if you're drinking it all day. So it can be difficult for some people. Other people seem to say they can drink coffee at 10 and it's fine. Seems to have to be most difficulty falling asleep. Diet is a huge topic again. So the most I can do in this one is just say healthy, balanced diet. It seems to improve your energy levels and consequently feeling a bit better during the day, and your sleep's a bit better and better quality at night. Bodies are a lot about rhythms, circadian rhythms and all sorts of other balances and rhythms. Having meals at the same time each day seems to keep the body in this sort of pattern for some. Keeps the body clock stable, as I've said on the slide. Having a meal later at night often seems to be problematic, and it does sort of make sense. There's a lot of energy diverted into digesting that food, and it's still sitting high up in the stomach and intestine. And again, a lot of this certainly research supports it, but there's a lot of anecdotal stuff as well from people who just say, yeah, I do feel better when I eat a bit earlier. And we're only talking 6 or 7. I'm not saying that you have to eat at 4 in the afternoon, although some people swear by that, but it is better to have a midday bigger meal, and many cultures do that. Though we have the other cultures that go out at 11 o'clock at night. Alcohol seems to be problematic and seems to affect the quality of our sleep. So at least 4 hours before going to bed is the standard advice, and it can be, as many people know, a few drinks send you off to sleep quite happily, and then you wake at 2 or 3 in the morning. Nicotine adds a stimulant that makes it difficult to go to sleep and stay asleep. So again, the general advice is try and get rid of it earlier in the day. Sorry, have your last one earlier in the day. Didn't click over. Means I need to have another quick little drink break. Talking about it, it's water, and water is very good for you. Okay. No, it's still not clicking. Here we go, during the day. Try the exercise, and earlier evening tends to make the sleep a bit deeper and reduce anxiety from one bunch of research. We've been told that. Practice the relaxation treatments during the day, as we've said. This is an important one, and starting to get onto the wake and worry stuff. Trying to put the day to rest. One of the useful things for many people is write a list of what's going on in your mind and make a time for the next day to actually sort it. So one of the things I've had from many clients over the years, I'm waking worrying, I've got all this going on, and I've got property problems, I've got financial problems, I've got succession plan problems, I've got crop problems, all these sorts of things. They've had them all day, and they've been bothering them all day, and they haven't solved them during the day, and then they think about them again at 3 in the morning, and it's a horrible place they're in because there's really no peace or no rest. If you can practice again, the brain is a very behavioural thing. It likes to be taught things and practice them and then try and stick to them. So you need to be a bit consistent in that. If you keep telling yourself, the brain at 3 o'clock in the morning, no, we've discussed this. This is my technique anyway. We've discussed this. We think about this in the morning between 10 and 11, and that's when we're going to think of it. We're not thinking that anymore, and then we'll do some distraction and think about something else. You all come up with your own techniques. These are core sorts of principles. Avoiding daytime naps. Some people will say, and some of the research argues, that 10 to 15 minutes is okay, but often if you have that 10 to 15 minutes, you don't need it later at night. So judge that yourself, or it could be good for a bit of power nap. You've been working really hard, you've been up since 4 or 5 in the morning. It could be quite useful. But do certainly try and avoid the really long-term ones. The long time one, sorry. Click. Okay, just to lighten up a bit, this is a real picture, a real ringer. Like many people thought relaxation, that's just for monks or something, isn't it? And you just do meditation and things like that in monasteries. But this was, again, a training session when we were taking people through the various stages of actually focusing their brain on various parts of their body. And when you get good at it, it's magic. And you can find, you can sit private on, in a chair somewhere for a while, rather just have a sleep, actually do this relaxation technique. It's quite restorative. You feel refreshed, and it hasn't been a nap, and it doesn't seem to interfere with sleep. Rather, it enhances it. So, really good thing to learn. And RFDS have got access to some. This is on the cover of the CD that someone kindly donated for us. Thank you, Glenda Cannard. Okay, bedtime routine. Again, routines, habits, great to train your body and brain in. The brain starts to recognise it's nearly bedtime. Some people have showers, some people have baths, some people have snacks, some people do quiet activity, they might listen to some music. Seems to be good if you dim the light, i.e. we're starting to train the brain that the lights are dimming now. We've got an hour of preparation, try and do some less stimulating things. Probably not great time to watch as many people do. A bit of a crime fiction on telly and wake themselves up, and particularly if it's going to part 2 and we're not going to see the end for 2 weeks. It's really annoying. But you can also make yourself go to bed when you feel drowsy or sleepy, not before. Get the bedroom pretty comfortable, not too cold and warm, not too cold, not too warm, reduce light and noise. Often said, use the bedroom for sleep and sex and not much else. Well, that's just one of the rules that used to go around with sleep hygiene. Someone else told me just this morning that, well, you should be allowed to use the bedroom to get dressed. So that's all right, it's your bedroom. What we're trying to get across is basic principle that try and get the brain into these patterns. So if you're going to go in and put the telly on and watch something really exciting, don't expect to go to sleep. Difficulty falling asleep. So some of these things now we've already covered. The daytime routine, the nighttime routine we've just talked about, perhaps doing some relaxation, and get up if you can't relax. So you do some relaxation, you're really agitated, you've just got angry about something that's happened at work this morning. You're really agitated, you've just got angry about something that's happened at work this morning. You can't really relax, perhaps get up. Avoid your caffeine after lunch, and don't do napping during the day. It's not useful. Do some relaxation during the day and the exercise during the day. The major thing to keep thinking about, is the perception line. How do I feel during the day? I'm a bit tired when I wake up, but I'm actually okay. So if you're having trouble falling asleep, it might be better to get up for a bit longer, and that's what we'll talk about with this delayed sleep phase. So this is a sort of a phase we talk about in terms of circadian rhythm. So you may need to reset the body clock. So it could be, the advice is you get up at the same time each morning, even on your days off. So you get a really good pattern going. This is going to take a couple of weeks, I'm sorry to say. It does take a little while, but persist with it. So if you find you can't get to sleep before 12, but you really have to get up by 5 or 6, you might need to start trying to shift this clock a bit. So if you're already getting up earlier, there might not be anything you can do about it. But if you find you're getting up, you're going to sleep at 12 and you're not getting up till 9 or 10, then start bringing that back by about half an hour each day. Spend an hour in the daylight in the morning, and it seems that, again, this is resetting the circadian rhythm. Try and get that habit going, that you're okay to go to bed that bit earlier. You can rest because you're good at relaxation now. You've done all your exercise. Tell yourself it's okay. You don't feel too bad anyway. You can survive this. It's not going to kill you. All the self-talk's in place. Get the bedroom nice and dark if you can, and try and gradually make that change. I keep wanting to say, does that make sense? I hope it's clear, because when you're just doing this soliloquy, it's hard to say how it's getting across. So do feel free to type those questions in if you want to. But I will give you the resources. You can check it out, and you don't have to just listen to it. Okay, next. Waking up at night. This is a doozy. This is what happens to many of us, and then you can't go back to sleep. Again, The relaxation can start to, if you're really well practiced at it, can be a very good distraction. So you're starting to think, you've already said to yourself, no, my thinking time is 3 o'clock in the afternoon or 10 in the morning. You've made a time for it, you've written a list. I'm going to do some relaxation because it's really helpful for the body anyway and the brain, and not worry about it, basically. I'm just not going to fuss about it anymore. The meditation aspect could be that you've learned a formal meditation technique, which might be as simple as just repeating a neutral word to yourself like one or the or two or whatever's neutral. It might be free or peace or whatever works for you, but it might be just repeating that slowly to yourself, focusing on your breath and quietly accepting the fact that this is just what I'm going to do and let my body rest, and my body will be okay with the rest. I don't want to demonstrate this any longer or you will be going to sleep. So they're the sorts of things you can research and learn and practice during the day. Get up and do something non-stimulating. They used to say ironing. Not many of us iron anymore if we can help it, but anything you can think of that's perhaps a bit boring. The other thing they used to say, which is probably dating you a bit, is get up and polish silver. Don't have a lot of that, but, you know, get the idea. What you can think of that isn't watching a really exciting program or reading a really exciting book. Same bedtime and getting up time. Oh, that's why it's there. Throw away the clock. Throw away the clock. If you keep looking at it and you haven't been able to get to sleep, oh, it's only 6, it's whatever, it's 3. Oh, it's 3:15. Well, it's 3:25. Hell, I've only got an hour and a half before I've got to get up. This is horrible. Throw that clock away. It's not going to help. It doesn't do any good. Find another way to set an alarm if you need to in another room. Or get children, I believe. That helps. Ruminating thoughts. We've covered a fair bit of that. Write them down. Try some distraction. Try counting back from 100 by 7s or 300 by 3s. Or it does work. I think some of the old things we heard about, like counting sheep, I've never quite been able to master that. I think they work. So come up with whatever you can yourself. Time to thinking during the day and problem solving. This is when I was talking about CBT before. Often it can help to find a good clinician. It could be someone online. It could be, if you're very remote, it could be through RFDS. It could be through another agency in your area that can provide counselling services. Your GP might know about something. But a lot of the sleep work that we do is actually nothing about sleep. It's helping people with their problem solving, their anxiety. It could be depression that they've got that they haven't known they had. It could be that they've got absolutely enormous amount of overwhelming real life problems, and sometimes having an objective clinician that can give you strategies to reduce the worry, the stress, the relaxation. You might not be able to fix a drought or an overdraft, but you might be able to get the level of anxiety down in the body that the brain can think more clearly. Perhaps you can exercise a little bit better, and you can see how everything comes in. Hence why I love being a nurse and a psychologist. The body and the brain are intimately connected, and what helps the body can actually help the brain adjust. So it's quite complex, and a professional might be able to help you work through, this isn't your fault, you've got into this situation, and these are the things happening. Let's the two of us help work on your brain to actually help you feel better psychologically and physically. Advanced sleep phases. I just diverted a little bit more on the treatment, but we'll whip through these next few slides in the next 5 minutes or so. Advanced sleep phases. So you're going, you need to reset the body clock again here. Again, this is when you wake too early. So sometimes you end up going to bed far too early. You really feel like you need some sleep. So you might be going to bed at 7, 6 o'clock sometimes, and there's many people I've met that do that. You don't have to do any of this, by the way. This is all about how you feel, and if that lifestyle suits you, you stick with it. But if you find you really do need to get to bed because you've got to get up at 4 a.m., but you can't go to sleep very early, try and just shift it up, even if it's 15 minutes. So say your bedtime's 7 o'clock, make it 7:15 or 7:20 or 7:30, whatever it needs, and do it each day for a week or so, and then just shift it. It's very gradual. Again, it can often be easier to work with someone trying to do this because it is not easy, and often we give up. We think, oh, I can't be bothered doing that. I'll just forget about it and just not worry about it. I've got other things to worry about. Outside daylight during the afternoon seems to be critical, and you can time this in beautifully with that afternoon walk if you can possibly find a way to do it. The dark bedroom, so get that light and dark happening in your life. You will be tired during the day doing it, but try and tolerate that. Have a short nap if you need to, but really try and push it forward if it's important for you to do this. Poor quality sleep. Reviewing medication could be critical here. It could be something that's interfering. Again, don't go off any medication without getting your GP's advice. That's really critical, and some things shouldn't be stopped immediately. Even if you do think there is a need for it, you do that under advice. Review the diet for deficiencies. Again, this could be a GP question. Again, too complex to go into it, but there's various nutrients that it could be interfering if you're having too many or too little. One of the things that you can be having too little of is alcohol, and unfortunately that doesn't have many nutrients in it. So that's one of the dietary things. We often don't think of alcohol as part of our diet, but it certainly is for many of us. Exercise recovered, daytime relaxation, the tired and wired feeling that you get. I love it if I do actually find time to fit in a proper relaxation session when I'm not running it, and I can actually just do it for even 10 minutes. If you're well practiced, that can be amazing for just, you are tired, but all of a sudden you can do these 10 minutes and you can feel really good at the end of that 10 minutes time and quite ready to go, and it's extremely refreshing. You don't need to try and make up for lost sleep. A lot of the research is saying mostly the research subjects are med students and psychology students, and they're tortured in the lab by keeping them awake. It's all voluntary, of course, and often there's a monetary incentive, but they keep them awake for nights and nights on end, and they feel tired, but there doesn't seem to be significant sleep loss that can't be caught up in a day or two. So sometimes we really worry about that, and again, trying to improve your sleep, the first thing to try and do is stop worrying about the sleep. See a sleep GP or a sleep specialist if you can. Sleep specialists are sometimes from different professions. It's not always that you have to go to a sleep lab. So, for example, you might see a clinician who's working out of Longreach or out of Cunnamulla or out of Townsville that have done special studies and courses in sleep psychology or sleep therapy. So just check them out and see if it's an area they know about. These changes need to be practiced daily or nightly for at least 4 weeks, and that is a really difficult thing to say to someone that I'm working with who has had chronic sleep problems and feeling really poor because of it. It's interfering with their life. They can't concentrate well during the day. They're irritable, they're grumpy, and then they've got to go and do even more work. So get support if you can, and even if it's just the written support that you'll see on the next slide from the various websites, it can be incredibly beneficial to have someone to talk it through and not try and do all this on your own. We did have a question that came through about sleep apnea, and again, this is like everything in this topic, it's quite a complex difficulty. But the shortest way, I think the most succinct way I should cover it for this presentation is to just say that sleep apnea needs to be diagnosed. It can be really problematic and cause some health problems. It's basically about people obstructing. So you've got an upper airway, your throat if you like, that sort of collapses a bit when you're lying in bed, and it blocks off the air supply. When your air supply is blocked off, there's less oxygen to the brain, and you will wake. You wake, and often with a startle, and start breathing again. But that can go for minutes. It's just quite a long time, which is really distressing for a partner. And these episodes can happen 100 times a night. That really does need to be diagnosed because it's linked at times to heart disease, certainly to high blood pressure, and then we've got to watch things like stroke and heart attacks. So certainly get it diagnosed, or if you're worried about a partner, because the actual person who's got it often doesn't know they have, but very typically they snore, so the household knows that they're snoring. They may not always be that loud, but they often are, and often they're overweight. So, and often they know they don't feel that well and they're tired during the day. So it is something that does need diagnosing. And there's very good treatment now with basically a pump called CRAP. It's a contiguous positive airway. So it's basically a pump that's quieter than people snoring, and people wear a mask. It takes a little bit to get used to, but that positive pressure from the air going into that throat area actually keeps it open and stops this little collapse that's occurring, constantly, 100 times a night maybe. So it's a really, really good treatment. There's also other sorts of treatments that specialist dentists can do with mouth supports and guards and things, but again, that needs diagnosis and treatment there. There's a site, the Sleep Health Foundation site, that's got excellent tip sheets about everything we've covered today and many, many, many other topics. So, and one of these tip sheets I'm looking at now, it's just on the page, and that's about this chronic sleep apnea. So whoever sent that question in, certainly get onto that site. So we'll let our pilot alone. He doesn't even know I put that picture on of him having a little rest before he had to fly away again. I can only thank you very much for your time. I hope it's been useful. The sleep information tip sheets I was just talking about came to sleep from Sleep Health Foundation. They're excellent. There's that website. Reconnection is the specialist agency I was talking about that deals with assisting people with sleep and anxiety problems. They've got all sorts of things on their site, including people you can just ring up and talk to about your difficulties. And they also specialise in assisting people reduce from their benzodiazepines, so the minor tranquilizers, the Valiums and the temazepam and Molbidons, and that's what the agency was initially set up to do. So they've got excellent information and support there. And Sleep Association is just another one, a peak body that's often used by clinicians. And if you want to look at some of the more research sides, I forgot to put on Beyond Blue. Sorry about that. It's a very good agency that encompasses all sorts of areas, and they've got some very good tip sheets on sleep as well. And I think that's really just www.beyondblue.org.au. So we'll put this stuff online. My colleague Hannah here, who's done an excellent job in setting this up, has just asked me to give her any of these sorts of sheets and things I want, and she'll sort that. And Hannah, I'll say goodbye, and do you want to just remind them about the recording of this today? Yep. Thank you for listening to me. I hope you sleep well. I will.
So we'll be on the line for another minute or so. If anyone has any questions, then just put them in the chat box now. And in the coming days, we'll get a recording back of the webinar and what Cath's been saying today. So anyone who's registered with an email address will be sent that recording, and we'll also put some resources on the AgForce website, which we'll send through to you as well. So I think that's about it from us. Thank you, Cath.
It is.
That was fantastic.